On now? Yeah. Okay. I'm Maria Janik, and I'm going to be talking about the relevance of BH4, NOS, SOD, and prevention and recovery of ASD PANS and need for immune shifting with NRF2 phase 2 detox promotion. I'm going to handle this in chunks. We're first going to discuss the BH4 cycle and the nitric oxide synthase and superoxide dismutase enzyme pathways. And then we're going to get into immune system abnormalities that we see with our children and the need to increase detoxification by upregulating NRF2. So methylation cycle, many of us have seen this slide before, and a lot of emphasis in the past 20 years has been up here in the front. Now, for technically speaking, this is methionine synthase, and coming around to the right and down, this is front-end methylation, and coming back around is back-end methylation. But for my purposes for the presentation, we're going to consider everything that happens in the front, where we use MB12 and methylfolate. I'm going to consider that front-end methylation, and I'm going to consider this part back-end methylation. That's what we're going to be concentrating on today. There's been a lot of emphasis on starting children out on methylcobalamin shots, folinic or methylfolate to get the cycle going, and Epsom salt baths to start improving sulfation. But then what we see sometimes in the patient population is kids may all start out all right, and then some children start to get better and remarkably better, and then everybody wants to do what they're doing. But what's happening is your child then may start having reactions or may start tanking, and we don't know why. And a lot of it is, I think they get hung up back here. So the parents are always telling me, Maria, dumb it down, make the science easier for us to understand. So today we're going to be covering inside your outside with how a healthy BH4 cycle can promote urea cycle and Krebs cycle for mitochondria functioning, that's health. And if you have an unhealthy BH4 cycle, you get reactive oxygen species and unhealth, and you can flare into autism, PANS, asthma, allergies, food allergies, juvenile diabetes, however your genetic predisposition is going to tip you. So this is just I just cut that graphic so we can see we're going to be concentrating back here, and I'm just going to walk us through the BH4 cycle across the rest of the cycle in the back end. So why do we want to look at the BH4 cycle? What's so important about this cycle right here? BH4 cycle is responsible for speech, language, communication, mood, focus, attention, formation of neurotransmitters, and sleep-wake cycle. Kind of important. One of the first things parents said is, how can I get my child to sleep? They're not falling asleep, they're not staying asleep. I want speech. So we run out, we want to do the biggest, most expensive, and most elaborate treatment options. And we haven't even looked at many times haven't looked at the health of the cycle, which these things develop naturally. So I'm going to explain a little bit about how the BH4 cycle becomes unhealthy and how we can get it up and running again. Okay, 1 fish, 2 fish, red fish, BH4 fish. So Dr. Amy Asco studied the BH4 cycle extensively, and she calls it a three-legged stool. So if you have a stool with 3 legs, and if any one of those legs are broken, that stool can't stand. So you're not going to have a healthy BH4 cycle. And this includes, I have slides that explain a little bit more about each issue with the BH4 cycle, but CBS upregulation mutations, MTHFR A129.8C specifically, bacterial aluminum, if we have children who have been vaccinated, we know they have a high aluminum load, gut dysbiosis, and they're hoarding bad bacteria in their gut. And that any one of these 3 things, if it's impactful in your child, the chances are they have a weak or not very well-functioning BH4 cycle. Okay, so we're going to start with the BH4 and work through, but where is, so the 3-legged stool, where's the CBS? So here's CBS, and when I talk about upregulation, when we start children on B12 or folinic or methylfolate to start turning the cycle, even Dr. Amy Asco says you can't see this CBS upregulation where it's moving too fast through sulfation until you start the vitamins and nutrients that are going to be pushing down through there. So that it starts expressing, or we can see that upregulation. CBS upregulation has an increase of sulfation, and sulfur makes ammonia. And if you have an impairment at SUOX, if you have nutrients that are weak and you don't have enough nutrients to clear ammonia, ammonia can build up in the system, and that will very quickly can drain BH4 in the BH4 cycle. The other three-legged stool is MTHFR. It's housed right here. MTHFR C677T moves forward methionine synthase. So when parents say, oh, my child has MTHFR C677T, that's the worst one. They're saying that will, can cause autism. Well, it can trip you in front end. Front end methylation trips you, but I feel back end methylation keeps you down. So front end methylation, if you're more heavily mutated in the front end and you give some vitamins and nutrients to get this going and you don't have any impairments holding you downstream, things can start flowing easily through these cycles, and then you see the kids start waking up and coming out of autism. Examples are the children who recover with an MB12 shot and a round of Valtrex. Well, how come not my kid? Well, chances are that your child may have something mucked up back here having to do with detoxification, which can trigger and keep you down into a PANS flare. The last is aluminum bacteria. And if you've seen an OAT test or a stool test, you know our children tend to have dysbiosis, and it's really hard to clear. And I'm going to cover one of the reasons it's hard to clear when I get to the immune system part on the second part of my presentation. And as you notice, it says ALUM, and it's a block right here. So aluminum and bad bacteria in the gut hoards aluminum, and it makes it harder to detox it. And then we have aluminum blocking the recycling of BH2 back up to BH4. So if you have any of these legs, and you have a CBS upregulation in ammonia, that's going to impact BH4 health. If you have been vaccinated and you have aluminum and bad bacteria, so many of our kids have at least one leg, if not all three broken. I do have a presentation on YouTube and Autism One before on just ammonia toxicity and autism spectrum, causation and treatment options. I'm just going to briefly cover how ammonia adversely affects this cycle. So it takes 2 BH4 molecules to clear 1 ammonia molecule. So we rapidly deplete BH4. And why is BH4 important again? Because that cycle is responsible for speech, language, communication, mood, focus, and attention, formation of neurotransmitters, and sleep-wake cycles. And then you have to have enough BH4 left over to continue downstream. So ammonia is produced as a byproduct of protein digestion, and then parasites, bad bacteria, candida, yeast produce ammonia. So if you have that dysbiosis going on, now you're adversely affecting these cycles. For clearing ammonia, you have impaired detoxification. And then these are some of the genetic mutations involved in ammonia detox. So if they're mutated and not working efficiently, you can have increased ammonia. Diets impact ammonia. So meat, protein, sulfur ingestion. Sulfur makes ammonia. And so some of the parents say, well, I've noticed that if I limit meat intake, my child seems to be doing better. And you're probably looking at impaired ammonia detoxification, a direct correlation. Supplements with sulfur can impact ammonia levels. A lot of kids can do well on NAC, N-acetylcysteine, but that's straight sulfur. So unless you know if you have a CBS upregulation or impairments in ammonia detoxification, when you're trying to calm a child down by supplementing NAC, you may be inadvertently increasing ammonia toxicity, thereby blowing out BH4 and actually decreasing your child's chances of having improved sleep and speech. And then there's also treatments that involve sulfur, which can also cause ammonia and then blow out speech, language, communication as well. So it pays to be aware of the mutations so you can customize a treatment plan for your child. So as I mentioned, the CBS upregulation is one of the stools. Sulfur to ammonia uses BH4 faster than supplied. The nitric oxide synthase mutation impact leads to elevated ammonia levels. And here again, you need 2 BH4 molecules for proper pathway function of nitric oxide formation. That's what we want, nitric oxide formation. We don't want NOS mutation to go rogue and express, and that's where we see we don't have enough BH4, And we only have one molecule, we get peroxynitrate, and if we have 0, then we get superoxide, which is oxidative stress on steroids. At the root, autism, PANS, and related is oxidative stress. Here, MTHFR is just disrupts the recycling and regeneration of BH4, and then we have the bacteria and aluminum. And bacterial infections trigger a more rapid breakdown of tryptophan needed for serotonin. And other presenters, including Steph Seneff on Thursday, said our children have low serotonin. And they can have low amino acids, including tryptophan as well. And when we look back at the BH4 cycle, you'll see that the BH4 cycle is responsible for the intake of amino acids of tryptophan and tyrosine to make serotonin. So when you have low levels of BH4, you're also more susceptible to parasites. They deplete B12, impacting methylation cycle. We get mast cell degranulation downstream, higher histamine levels, PST reactions. That's the phenylsulfotransferase pathway. That's where the parents say, my child can't handle phenols. My child's laughing, I think it's yeast, but I saw that my child's yeast is cleared. And it can be, there's a connection between CVS upregulation and PST pathways and low levels of BH4. They sort of balance each out. You need health in both. The body will prioritize ammonia over making neurotransmitters, which affect speech. So for giving sulfur supplements trying to get speech, and we're creating ammonia, the body says, this is toxic. I'm going to clear ammonia. I'm not going to make neurotransmitters for speech. And the parents go, what do I have to do to get speech? Aren't I doing everything? I'm giving them all these supplements that in another child, they get speech. And why am I not getting speech? Well, you may be draining BH4. So quinolinic acid, and Dr. Usman Singh was talking about this last night as well, and we can see it raised on an oat. It's very excitotoxic. It's linked to seizure activity in the limbic in the brain, flu symptoms, light sound sensitive. So you see parents on the group saying, my child's light sound sensitive, or light sensitive, especially they'll come and say. And then parents may say, well, I think that's oxalates, it might be oxalates. And it's like, oh yes, oxalates are high on my oat test. Well, it's also the quinolinic acid. And I can look at an oat test and see markers other than the arabinose being high for yeast or the Clostridia being high for bad bacteria as a marker. You can see how healthy or unhealthy the BH4 cycle is by other indicators. And quinolinic acid, I usually say the BH4 cycle is blown. Krebs mitofunction markers and amino acid imbalances in Krebs mitomarkers, I usually say the BH4 cycle is blown because the health of these cycles starts here, and so does the unhealth. So high levels, we get high levels of reactive oxygen species, superoxide, and pairs NOS 1, 2, and 3, arginine and nitric oxide equals peroxynitrite, superoxide, NMDA stimulation, raised glutamate, neuronal generation, and loss of NADH. So we need a healthy BH4 cycle and recycling of BH4 across nitric oxide synthase. And you see what blocks that? Lead. I've been looking at over a decade at hair toxic metal and urine toxic metal tests, and our kids have lead. And it's not just back in the day, it was mercury, mercury, mercury. But when we do chelation challenges and we see the mercury coming out, we also see lead. And some kids have more than others. My youngest is way more lead toxic than my oldest, and it blocks right here. So if you're mutated at NOS, and if you have lead, how healthy do you think NOS is out of the starting gate? And in order for it to function properly, not only do you need things like vitamin C as a cofactor, you need a healthy amount of BH4 coming across. You need 2 molecules of BH4, and what do we normally have? 1 or 0, so we get peroxynitrate and superoxide. Because you need healthy amounts of BH4 across a healthier supported nitric oxide synthase, so we can get citrulline and NO, turning into arginine synthase and NO, up to Krebs for mitofunction. Parents go, my kid's a mito kid. My kid's a mito kid. They're all mito kids to some extent. And one of the ways they become a mito kid is if you're not working BH4 across NOS, for healthy Krebs mitofunction, which will show abnormally on an oat, as I said, in other labs. Instead, you're getting peroxynitrate, superoxide, neuronal damage, microglial activation. A lot of our kids had an MMR shot, and I don't know if you've ever checked antibody titers for measles, mumps, or rubella. You have to do quantitative so you can get a reference range. Otherwise, your doctor will come back with just immune or non-immune. We want the reference range because we want to see how high those antibodies are. because rubella antibodies destroy GAD enzyme. You see this little green rectangle here, GAD. Glutamate has to be converted by GAD enzyme into GABA, neurotransmitter for calming, and for memory recall, and for learning. Instead, we get excess glutamate shooting right up, and guess what it's contributing to? Microglial activation, neuronal damage. So our kids are supposed to be going across from BH4 here. This is health. This is unhealth. So we have a cascade of events starting up here with an unhealthy BH4 cycle, not functioning across NOS, blowing up. What do we get? Boom. Your kid just fell into autism, or PANS, or PANDAS, or asthma, or allergies, or food allergies, and I suspect we could go on juvenile diabetes, rheumatoid arthritis. So some test results indicating increased BH4. These are some labs. And increased ammonia is tricky. It's hard to capture ammonia. Parents say, how do you test for ammonia? Usually our kids are our best lab. And their ammonia, in my ammonia presentation previously, I talk about some of the symptoms. And it can be problems with transition, brain fog. They can be laughing one minute, crying the next. They can be aggressive. They can bite. I had a mom that for a week, she was telling me symptoms of her son, and it sounded like something that could be typical of yeast or something else. She goes, and he won't stop biting people. I go, that's ammonia. That's ammonia. Within 2 days of low appropriate dosing of L-citrulline, which is in the center of the urea cycle, she had him back to normal, and she really thought she was going to have to institutionalize him and put him on psych drugs because it had been going on over a month, and he was just out of his mind. Within 2 days, he was normal by supporting that cycle. So just want to mention again that, as Dr. Yasko has shown, when we start biomed, goal interventions and methionine synthase up, sometimes we can't see a CBS upregulation and phenylsulfotransferase pathways until we get these cycles moving, and then they're moving too fast, and they're like, what just happened? My child was doing so great. We started the diet and supplements, and now he crashed, and I don't know why, because my girlfriend's son's doing great on the same supplements. So we have to look at these mutations. Supplements that may help recycle and thereby increase BH4. These are required. These are required for the cycle to fill up. So depending on genetic mutation, folinic or folate or methylfolate, magnesium is a cofactor. The lithium, chromium, selenium, the are usually in micrograms doses. Magnesium is so important, we usually dose it in 100 milligram increments. B6, vitamin C, and then copper. After you correct zinc copper ratio, you don't want to exacerbate a ratio imbalance, which causes a retention of toxic heavy metals. You need a working mineral metabolism. So the primary cofactors in BH4 reactions are iron, B3, methylfolate, zinc. I've been known to say zinc, 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 zinc. It's involved in over 100 enzymatic pathway processes in the body. It's critical. So supplementation, if low, tyrosine, tryptophan to start filling the BH4 cycle from top down, 5-HTP. I like energy testing to see if a child needs tryptophan or 5-HTP, although you can often see on an OAT test where the breakdown is in the enzyme pathways, and if they're just not filling up and making enough serotonin, or if at MAOA, if they're having issue, you could say 5-HIAA is higher on an OAT test. And citrulline, and this is Dr. Iasko says citrulline, because citrulline in the urea cycle is connected at NOS right to the BH4 cycle. And if you can spare some draining of the BH4 with a simple amino acid, citrulline, getting the urea cycle health going, then maybe you're not going to drain as much BH4. You might have 2 molecules left over to come across NOS for a urea and Krebs cycle. And we see that parents say, geez, one of the easiest things they can do is a sprinkle or more citrulline, especially for the meat eaters, to keep that urea cycle moving, and it's sparing the draining of BH4, because as we saw, it takes 2 BH4 molecules to clear 1 ammonia molecule. Well, what if it doesn't have to clear as much? What if we're not forming it in the first place? What if we're making sure we're mopping the ammonia and we keep that BH4 cycle nice and healthy? All right, so we're talking about BH4 cycle. What's next on the list? Nitric oxide synthase. So NNOS neuronal, INOS inducible, and endothelial NOS. These are also known as NOS 1, 2, and 3. I like the graphics showing here, but I have a slide because although NOS 1, it talks about blood pressure regulation here, they don't have the graphic for it here at NOS 2, and I do have scientific abstracts showing that NOS 2 is also related to blood pressure regulation. So how many in here have heard of POTS? It's been amazing over the past decade how many moms, especially of kids with autism spectrum or PANS or PANDAS, say, oh, Maria, I was diagnosed with POTS. I'm like, well, have you seen your kid's mutations? You've got the same ones he does, to much extent, apple tree. And we saw that blown out BH4 across NOS, especially if they're heavily mutated in the blood pressure NOS mutation pathways, if you don't have enough BH4 yourself going across a mutated NOS, you could start having NOS expressing with blood pressure abnormalities. For our children, a lot has to do with NOS2, a nonspecific immune defense, mediation of inflammation, septic shock. This is clearing of pathogens. And ENOS, NOS3, and Trifletti has a database, and I'll show you a little bit more about that, talking about ENOS3 for our children. Okay, so nitric oxide synthase, instead of the graphics, I can tell you a little bit about the neuronal and central and peripheral nervous system, inducible. So if you see an NOS2, this is mediator of nonspecific host defense and clearance of bacterial, viral, and fungal infections. These pathways are important for the body to regulate clearing of pathogens. It's not just kill, kill, kill. It's not, well, how many herbs can I stick in this kid? Can I use antibiotics? Can I use prescription antifungals? We may need to temporarily use these prescriptions to lower the oxidative stress, to lower some of this pathogen load. But why is it the parents are with the doctors for 1 year, 2 years, 3 years? They say you have to keep doing this. You may be doing it indefinitely. They're going to go away to college and still be on their antibiotics. We have an immune system that clears pathogens. Now, granted, there'll be times where we can fall behind and we may need short-term use, short-term appropriate use of a prescription. But the hope is that the immune system will turn back on appropriately and clear these pathogens. So parents go, I can't get rid of yeast. Well, have you looked at the NOS mutations and health of BH4? And NOS3 here, oxidative stress leads to superoxides, oxidative stress on steroids, and it reacts with nitric oxide, neutralizing its vasoprotective effect. And an essential cofactor for all of this is BH4. Okay, I don't know how well this graph is coming across, that this is NOS2, and it shows in NOS2 expression in human infectious diseases. So expression means that we're seeing an abnormal, unintended expression where we want NOS to go healthy and across urea to Krebs. Instead, we have the expression of peroxynitrate, the superoxides, the reactive oxygen species in unhealth. Some of them are tied to not being able to clear H. pylori, myco. I know a lot of kids who, when myco flares, they get a PANS flare. And I find a lot of NOS mutations with these kids. Urinary tract infections, malaria. Here's another one. This is NOS2 expression of cytokine profile in human autoimmune and chronically inflammatory diseases. Well, what's autism and PANS? It's autoimmune and chronically inflammatory diseases. And look at all these interleukins that are the same. Interleukin 1, interleukin 6, tumor necrosis factor alpha, all this inflammation here. And so we have abnormal expression of NOS, in part because we don't have enough BH4, and then we could see the diseases that you're going to trip into depending on your genes. Thanks, mom and dad and grandma and grandpa. Rheumatoid arthritis, MS, asthma. We have ulcerative colitis, Crohn's, so gut, celiac, gut. Psoriasis, so skin health, immune system. So this inflammation, and then your genes are going to help determine, and then environmental exposure to what you're going to get. So cofactors, and these aren't things that are nice to have, these are things that are required. I have a parent come and say, I say, well, where's your program? They go, well, I gave you the list of prescription medication my child is on. I'm like, but where's your child's program to support for the genetic mutation pathways which are expressing in health history, labs, and current symptoms? Because I can see this. You know, you've heard in Sixth Sense, I see dead people. I can see BH4 impairment. And I can see it in health history. In fact, I look at health history and labs and can see the expression of these mutations before I ever look at the genetic mutation SNPs. And so when a doctor says, well, I don't look at mutations because you don't know if they're expressing or not. You just don't want to willy-nilly give vitamins and nutrients for mutated pathways if you don't know they're mutated. You can see if they're mutated. And usually just by looking at a child, you can see if they're mutated. So arginine, again, urea cycle health. And then we have folate, zinc, iron, niacin, and on through. I want to make sure I pick up the pace a little bit so we can get all the slides. So nitric oxide synthase limitations. Well, as we saw, lead blocks this. If you have mutations, you're already impaired. Omega fatty acids. So omega fatty acids, fish oils. I have moms on the groups who come on and say, I don't get it. My kid can't handle cod liver oil. Every time I give him these omega fatty acids, and he seems to be okay at first, and I give him for any length of time, he has a histamine flare. It's you can't give omegas because of high histamine. Omegas do not have high histamine. If you look up cod liver oil, it's low histamine. Well, but Maria, I tell you, when I give my kid cod liver oil, he has mast cell activation and histamine response. I go downstream. Because if you don't have enough BH4, and I ask mom, is your mom's BH4 cycle healthy? And they're like, what's BH4 cycle? Don't know. And does he have an NOS mutation? And so there is a law of diminishing returns on these omega fatty acids. They're good, we need them. Our brain's like 20% DHA, we need these omega fatty acids. So we pulse dose them every other day. A lot of kids test very well for doing it Monday through Friday. It still works Saturday and Sunday. These cycles continue to turn. But we don't want to risk shutting off NOS, because if we shut off NOS and we're not working urea to Krebs, what do we get? We get mast cell activation, we get inflammation, we blow out at SOD-GST, which we're going the pathway next. And what is that? That's PANS, that's autism, that's Lyme expressing, that's mold expressing, and saying that I'm trying to pull out a mold, I'm having mold problems. Well, you need to support this back end of the cycle in order to clear mold and get out of it. So lipid donors also, transdermal cream. So think about the fats, okay? Liposudical glutathione, high doses of EFA. CoQ10. CoQ10 is interesting because parents say, my kid's a Krebs mitokid, my kid's a mitokid. And a doctor increased the CoQ10, my doctor increased leucovorin. But CoQ10 is a lipid donor. And what did I tell you about lipid donors? They can shut off NOS. So I like energy testing to see if the child needs more CoQ10 than what's in the multi, and if they can tolerate it, and if we need to pulse dose it or keep it very low. I have a lot of kids who do well on low dose CoQ10 that's in a multi, but cannot do high doses of CoQ10. And these parents say, well, mitochondrial function's still showing impaired, so my doctor keeps increasing CoQ10. Well, you're going to keep going down to oxidative stress. You're not going to get up to Krebs mitochondrial function to get for mitochondrial support. You're working against yourself. Just a quick thing of CoQ10. We used to list it as a methyl donor, and L-thenine's a methyl donor, methylcobalamin, methylfolate. We know these are methyl donors, and they could make too much dopamine, and then if you have a COMT mutation, then you can see ADD, ADHD, excitotoxicity, heart racing, aggressive child. Lately, they've come out with a list saying, well, you don't have to worry about CoQ10 being a methyl donor because it's not. No, it's not a methyl donor. There is no methyl attached in the chemical structure of CoQ10. However, it's a methyl modulator. So parents are not crazy when they tell you, I don't care what anybody says. I give my kid CoQ10, it's like I gave him methylcobalamin. He reacts the same. I don't care if they say there's no methyl in it, it's doing something. Yes, I found information literature saying it's a methyl modulator. So Dr. Rosario, scoop on NOS. I'm going to introduce this, and I'm going to come back to it because I have some abstracts that I've recently added to my slides, and I put them a little out of order, and I don't want to be flip-flopping back and forth. So he has a database on children with autism and PANS, And what we see is if you have early diagnosis and early tipping into problems with mast cell activation and microglia activation, neuronal damage, if you interrupt neurodevelopment early enough, you don't get speech, language acquisition, and toileting, then they call it autism. If your child sneaks by and seems NT, and I say seems NT, and they may or may not be healthy, but if they're neurotypical, if they're talking, then they don't qualify for autism. And then the one straw that breaks the camel's back may tip them into a PANS flare. If he says if it can give you a fever, it can trigger PANS, but what is it? It's an alternative fever response, so some of these kids don't appear to be sick, but there's a slow burn happening underneath. All right, so this study, I have 2 pages on this study from Frontier Neuroscience from July, just from less than a year. This was published just less than a year ago, and I'm really excited about this. Because they started looking at the BH4 pathways, why? In relevance to pathophysiology and treatment of inflammation-driven depression symptoms. What's this inflammation-driven depression symptoms, Maria? Well, they found that in persons who are chronically ill, they have a high rate of depression. And the reason they did a study is the antidepressants aren't working. So they want to say, well, maybe we actually should look at biochemistry because we're handing out these antidepressants at a higher rate than ever before. We have all these chronically ill people. They all seem to have clinical depression symptoms. This isn't just I'm sad because I'm ill. These are profound depression symptoms. We've been hearing in the news that suicide rate is going up, especially amongst young people, and especially amongst girls in the Gardasil generation. And what else is going on here? So they looked at, all right, well, where do the antidepressants work and what else can we do so we can make a drug to fix it? And they went, this is fascinating. We found out that these people who are chronically ill and they have this inflammation, and if you look, study covers lipopolysaccharides from gram-negative bacteria in the gut, and we know that those get reabsorbed in the gut into the bloodstream and get hit on the limbic and cause excitotoxicity, right, and cause symptoms of PANS and PANS. Because strep can too in the gut. It's not lipopolysaccharide, but that can also go up and cause symptoms. NSAIDs, interleukin-1, interleukin-6. Well, what am I showing you in the slides on NOS? These inflammatory interleukins, right, and expression in disease states. Tumor necrosis factor alpha, interleukin-17, which drives up Th17, which is autoimmune, NMDA receptor, C-reactive protein. I could go on and on and on. I could do an entire talk just on this article. So this is a continuation of the article. Wait, did I say the? Yeah, so they just show that such combination results in an uncoupling of NOS and consequently reduced production of nitric oxide in favor of inflammogenic reactive oxygen species, which cause further oxidative BH4 loss. Altogether, these data strongly support the role of both the K and BH4 pathways in development of inflammatory-related depressive symptoms. And further contributing to the global burden of depression, most of the chronic diseases whose prevalence is also continuously rising, including metabolic, autoimmune, and cardiovascular diseases, are all associated with increased risk of depression. And importantly, direct KP activation within the brain is sufficient to alter emotional behaviors in rodents, particularly when it occurs in key brain areas for behavior and mood, particularly the hippocampus. The limbic, all hitting up here in our kids. Okay. There's a lot of talks this past weekend. You've probably seen at least one PANS presentation, so I'm just going to quickly go through these slides so I can get to the immune system slides. But there's PANS mechanism stages, not disease. So you get the inflammation, auto-inflammatory, autoantibody, brain injury. Dr. Cunningham was speaking about a panel that you could run to see a sampling of some autoimmune antibody markers that can show you potentially how far gone your kid is towards the autoimmune. So if they're low and in range, then like I said, it's a snapshot of a few, then you hope that the Th1, Th2 immune imbalance, which I'm going to be going into after I finish SOD, you hope that that imbalance isn't driving up autoimmunity. But even if markers are mid-range or high, it doesn't mean all hope is lost, abandon all hope who enter here. We can get these trains back on the track in these cycles, and we see a reduction of oxidative stress, a normalizing immune function, and that Th17, as that starts coming down, we see the autoantibody markers also decreasing. So, but the best science is our children. You see them getting better, and you know those markers are improving. Pan's list of symptoms was voted on, and a lot of these are very familiar to us. There's 2 pages of the symptoms. Okay. So Dr. Trifoletti said, geez, in our database, I don't think autism in PANS is MTHFR. Well, when I started, it was all MTHFR, get front-end methylation going, get sulfation going. He said, what we're seeing is these kids who are stuck in autism and PANS, they have NOS mutations. They're blowing up from BH4 to NOS. And they're going straight down with increased oxidative stress, and boom, they're flaring. I just want to mention mTOR. Some of the other presenters are talking about, I've mentioned mTOR. It's downstream from NOS. So if you're abnormally expressing upstream, then it can adversely affect downstream expression. And they said a lot of the studies coming out on health, chronic illness, is we're going to be seeing in the abstracts, is on mTOR. Okay, so now we've covered BH4 across NOS and urea to Krebs cycle. And now we're going to be looking down here at GST and SOD. Superoxide dismutase and catalase. There is a CAT mutation, not all the SNPs check it, but it's CAT, it's CAT mutation. So it's a linked susceptibility to autism, PANS, and Lyme and mold and asthma. Well, how is it Lyme and mold and asthma? Because if you are flaring by blowing out your GST and SOD pathways, that's when you flare. And Lyme, you can be born with congenital Lyme and be asymptomatic for your life. Why are we seeing so much Lyme flares, Lyme expression? Is it that we're better at diagnosing? In part, but it's because we're seeing more expression of it. Doctors weren't missing these chronically ill people with Lyme, I don't think, 30, 40, 50 years ago. I don't think it was expressing. I think it was in the system like chickenpox, suppressed by proper methylation cycle. When we blow up at GST and SOD, and if you have Lyme, it can express. And you can kill all you want. Why are these people still chronically ill? They're not resetting their back end of methylation. So you have to work both sides. And what's so cool is 1969 discovery of SOD has been called the most important discovery of modern biology never to win a Nobel Prize. It has laid the foundation for a whole new field of biology and medicine. It's the study of free radicals. Antioxidant free radicals, ads on TV. Vitamins and nutrients you can get at CVS. Antioxidant enzyme serves the body's most potent defense against free radicals and ensuing inflammatory reactions, and they include glutathione. So the GST path or glutathione peroxidase, catalase, and perhaps the most important internally generated antioxidant of all, SOD. Okay, it's the limbic. So we're blowing out BH4 across NOS, and we're blowing into a PANS flare at SOD and GST pathways because we have all this oxidative stress from the vaccines and from the gut, and phase 1 liver detox naturally makes toxins more toxic, so it can be recognized by phase 2 liver detox and can be conjugated or neutralized, made water soluble, so we can pee and poop out the toxins. But what happens instead is when we shut down and we blow up at GST, SOD, we get mast cell activation, inflammation, histamine reaction, oh my gosh, PST reactions, I don't know, my kid can't handle phenols. He's super sensitive, can't give him any supplements. And then we get all this excitotoxicity up here. We can get NMDA antibodies, okay? We can get basal ganglia antibodies. These are all immune. And what does this limbic have to do with? Hippocampus, learning and memory, basal ganglia, control of movement, we can get tics. See here, I'll be talking about this a little bit, the olfactory bulb right here, where group A strep can come right up, get absorbed through the olfactory bulb, and hit on the limbic here, causing PANDAS. I only show this slide because it has the pineal gland, which I love, and it didn't show it, so I just wanted to pay homage to the pineal gland. So we're going to go on. Okay, group A strep, this is a study from 2016 showing, gee, that's interesting. Strep can go right to the brain, and we've previously shown that group A infection in mouse models induces a robust Th17, that's autoimmune, a robust response in nasal-associated lymphoid tissue. Together, these findings provide insight into the immunopathology of neuropsychiatric complications that are associated with group-A strep infections and suggest that crosstalk between the central nervous system and cellular immunity may be a general mechanism by which infectious agents exacerbate symptoms associated with other central nervous system autoimmune disorders. Okay, immune function. So we're supposed to have normalization and a balance between Th1, Th2. And we've seen in vaccine studies that our kids can get locked into a Th2 hyperimmune, food allergies, sensitivity to supplements, driving up antibody production. And we can have lower Th1. The study of immune shifting, when I started looking at immune shifting, it was the science of the original GCMAF. And what they were trying to do is switch this back to normal immune functioning. Because Th1 activates macrophages, which kill and clear pathogens. It's part of our normal immune system. And we didn't have that, because what do we have? We have chronic infections and overproduction of antibodies. It's not normal immune function. Just by definition, parents say, well, can I test for this? Yes, Dr. Usman Singh said that, but really, does your kid have autism? Then he has this imbalanced. So we have PANS, he has this imbalanced. And we have T helper cells, and Dr. Shade was talking about T regulatory cells this morning. But look at tumor growth factor beta, interleukin-6, inflammation, inflammatory interleukin, cytokine, upregulates Th17, and this is how you drive up a Cunningham panel, and this is how you get diagnosed with an autoimmune disease, and then parents are frantic saying whether they can get IVIG covered by insurance or not. And so we want to stop this inflammation driving up to Th17, and also one of the best ways we do it is we start to normalize Th1, Th2 through immune shifting. Well, how do we do that, Maria? Well, some of the examples were the original GCMAF, which is now the ReRUM, which is now Immuno, and what it does is specifically through 2AG upregulates an endocannabinoid, Th1. You see the STAT4 here? 23andMe and Ancestry checks for this mutation. If you have a STAT4 mutation, which is what drives to help Th1 upregulate, you are less efficient in immune shifting. If you're less efficient in immune shifting, you can keep pathogens around longer and overproduction of antibodies. And when I studied this immune shifting, I found, and when I get done, I think my next slide will have it, the one after that. Okay, so what I found is that that there are over-the-counter supplements, things like ashwagandha, Immunofen is one of my favorites. It's Scott's pine cone extract that can help start to, even though we're a little blocked here, kind of promote more Th1 activity. All right, things that increase Th17 cell ratio, well, gut dysbiosis, intestinal infections, chronic inflammation, circadian rhythm disruption. Where to get circadian rhythm disruption if we don't have a working BH4 cycle? Chronic stress. Our kids are also stuck in fight or flight. Things that increase the things that decrease the Th17 upregulation, soluble fibers, butyric acid, sodium butyrate. A lot of our kids will show low in butyric acid, their colon's unhealthy, they need some short-chain fatty acids on a stool test. Probiotics, once you've picked some of those weeds out of the gut, then you can start colonizing the good grass seed and fertilizer to increase probiotics. That's been shown to drive down this autoimmune part, this Th17 that's driving up. Vitamins A and D and zinc. I don't know anybody in here who's ever done the PANDAS-PANS OCD Shedder protocol. Basically, if your kid's going into a flare, they recommend ibuprofen, Benadryl, but also doubling, sometimes tripling, and sometimes even higher on the vitamin A, and doubling your D for X amount of days, and doubling your zinc. Well, so your kid's starting to flare, right? You can see them driving up Th17 is going up. They're like falling, they're going into flare. What can I do to stop it? And so these are some of the things that we do short term. And then we probably need to go back to the BH4 to NOS, Urata Krebs, and make sure we have all the nutrients in there that's appropriate for that child to get that cycle healthy again. So glutathione, I talked about GST, glutathione S transferase down at SOD. This just shows that there's related factors in oxidative stress and autism. In addition, the activity of glutathione peroxidase superoxide dismutase, that's SOD, and catalase as part of the antioxidant stress system are decreased. Decreasing the oxidative stress might be a potential treatment for autism. It's because autism is oxidative stress. So if we can get rid of the oxidative stress, we get rid of the autism. Glutathione levels in antigen-presenting cells modulate Th1 versus Th2. Early on, coming to these conferences, guess what they said in studies? Our kids have low levels of glutathione, in part because methionine synthase isn't working to turn around the front end of methylation down through sulfation, right? And Jill James did great studies in sulfation. And so we have low levels of glutathione. If we have low levels of glutathione, we can be locked in Th1, Th2 imbalances. If we're locked in a Th1, Th2 imbalance, we're driving up Th17, boom, the Cunningham panel goes up, you have an autoimmune disease. How did we get an autoimmune disease? This in part, low levels of glutathione. And then we need these key antioxidants for detoxification too. Here again is another one, that liposomal glutathione supplementation can restore Th1 activity. When I talk about immune shifting, there's more than one thing that we can do. So we can, if a child is ready and we have them on a good program and they're ready for an advanced treatment like ReRum, that's big guns to get in there and get the immune system, or immuno now, get the immune system reset. Sometimes these kids, if you get BH4, NOS, BH4 cross NOS to urea Krebs cycle working, they reset themselves. Because that naturally is sending less oxidative stress down there for detox, and detox catches up and is able to start flowing those toxins out of the body, thereby lowering oxidative stress. Sometimes the body's like, oh, I got a relief. I immune set. I can immune shift back to normal immune function. We've seen this in some cases with antibiotics. A kid falls into PANS, we put them on antibiotics, or antivirals, or whatever the labs say, hey, they might need, and they lower the oxidative stress of that pathogen load just enough, and if maybe that child wasn't heavily mutated on this back end, and they reset, and then the doctor said, see, the treatment for PANS are these scripts, they work, but they didn't work for my kid. We just have to keep doing them. But we've done them for 5 years. They're not working for my kid. You may want to look more closely at your child's unique genetic medical profile and appropriately support for these cycles so that these treatments can work. And doing what another parent does for their child, you don't see their mutations. So how can you know if it's appropriate for your child? Okay, this slide is a recreation of Dr. Shade's slide. He does know that I copied it. In fact, I had a photo of his that I used to use in here, and I said, listen, I'm going to have my slide guy redo this slide so it looks like mine. But I just love it. Here we go. Th1 and Th2 imbalance. Our kids are stuck in a cycle, right? What is this? Stuck in autism, stuck in PANS, stuck in PANDAS, stuck in asthma, stuck in food allergies. And it's like, I don't get it. When I started this, my kid's food allergies, it wasn't bad, and now he's reacting to everything. I've been doing biomed for 4 years. Why are my kids' reactions worse now than when we started? This is ridiculous. Because you're not immune shifting out of this cycle. Here, that's LPS, lipopolysaccharides. Dr. Shade said this morning it's all about the LPS, gram-negative bacteria, and it's hitting on the limbic, right? Vascular permeability, that's leaky blood-brain barrier. So you have immune dysregulation, Th1, Th2 imbalance. We have raised Th2, hypersensitivities, food allergies, asthma flares, Lyme flares. We have chronic infection, right? We can't clear. How come my kid's oat test is still ugly? How come my kid's stool test is still ugly? We're stuck. Th1, Th2, and what happens? Th17 comes higher, 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 and if you do not get out of the cycle, eventually your Cunningham panel is going to look ugly too. This is just a little bit about the development of Th1 and Th2 subsets. As you can see, STAT4, which the old 23andMe and Answers check, if you're mutated here, are you that efficient at activating Th1 cells to activate macrophages to clear the pathogens for normal immune function? Instead, our kids are stuck over here, Th2. All right, there's crosstalk between them. So we get the CD4 cells, and some of our kids can be low in these to begin with, so we don't even have good manufacture going this way. So I talked about Immunofen, Scott's pine cone extract. Dr. Cheney had spoken about it, and that's where I picked up on a poor man's ReRum, because for $900 to $1,200 it was at the time for the GCMAF, times 2 children, times there was a rules of 3. And one was, these kids are doing miraculous, they had just 1 month of this, and they're fully recovered. Fantastic, that's what we were hearing, right? And the second group said, I don't know, I see nothing at all. I have no idea. I just keep paying the $900 to $1,200 a month, but I don't know if it's doing anything or not. The third was like, my kid crashed so bad, and the reason you're not hearing it is I can't even get on the group to tell you how bad my kid did, and I feel like a failure as a parent that how come I did what Susie did for her kid and it worked for her kid, not mine, because they sound the same. Well, guess what? Broken methylation sounds like broken methylation. Where are they broken? That's individualized. So Immunofen, and I love the products, the Rerum, like I said, I've used an Immuno, but it's an investment. Immuno's $650 a bottle. Immunofen that I get through my guy in Canada is $49 a bottle. And you can energy test for drops, just drops. Both of my boys had severe PANDAS. It was strep, both ASOD and SAB for years. And that didn't matter. And I was one of the top MAPS doctors in the world. And it didn't matter. Every year we tested, it was just like, oh, ASOD and SA is just through the roof still. It's just so hard. And I didn't want to use antibiotics because they had amoxicillin at the time, scarlet fever, and they tipped him with the gut dysbiosis and tipped him into this immune system abnormality. So I wanted to use naturals as I could. However, I have seen, my children's strep titers weren't as high as others I've seen. I have a girlfriend, her son's strep titers is greater than 3,000 because the machine stopped counting. Well, in those cases, we may need to use an appropriately picked antibiotic script to help lower some of that stress, because I don't think if it's that high if you're going to be able to immune shift anyway. In less than 1 year with Immunofen as part of my program, and I stopped that kill mentality, I started studying immune shifting. How can I get this online? How can I get my kids' immune system to start working? In less than a year, both of my children, I had an N of 2 in the study, ASO and DNSA titers dropped like a rock into normal range, got rid of PANDAS. I was like, are you kidding me? I've been doing the definition of insanity is doing the same thing over and over and over again and expecting a different result. That's what I was doing. Kill. How come my kids still have PANDAS? How many killers do I have to put in there? I wasn't supporting for their genetic medical profile, for their natural immune function. Then you can work on the pathogens, lower oxidative stress. So this Immunofen, it's really cool because you see how this crosstalk inhibits macrophage activation. Immunofen comes in and just gently does a swath right across there, just gentle, boom, and we can get some macrophage activity going, and our kids start killing the pathogens. I have parents say, oh my God, my kid stopped getting yeast infections. I don't remember when my kid didn't have a yeast infection. What's happening? I go, you're immune shifting. You're immune shifting, so. Support for phase 1, 2, and 3 makes me happy, you can see. Liver detox, phase 2 liver detox. I gotta speed this up. So right in here, we have phase 1, which makes toxins more toxic, phase 2, which is sulfation, glucuronidation, glutathione conjugation, acetylation, amino acid conjugation, and methylation. And then we have the biliary, and Shade's all about the biliary. You gotta have the bile flow to grab on and get the toxins out, and it's a very efficient system. The body will recycle the bile it doesn't use. Here is what I call the yellow brick road of oxidative stress, and it's kind of similar, our kids get stuck here between phase 1 and phase 2, and so for the parents of the kids who have had constipation or chronic constipation, a lot of it's tied to when you shut down phase 2, it's directly related to phase 3. So we have impaired BH4 across NOS, we blow up SOD-GST, and we get inflammation, mast cell activation. The kid goes crazy and he's constipated again. It's a boom, 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 and it can happen very rapidly, a lot of these kids. So we have some vitamins and nutrients here that we need for to connect phase 1 to phase 2. And I have parents say, but Maria, my kid's been on all these. They've even been on all these at the same time. Why am I still stuck here? BH4, NOS, SOD. You have to support it all. Okay, there's a close-up. Reactive oxygen intermediates, secondary tissue damage, free radicals. Okay. I like this because it shows some of the cytochrome P450 enzymes. One of the ones I see a lot is the CYP1B1 in these kids. The ones I said are still being held down. I have parents who say, I did the Great Plain Lab tox panel, and my kid's, it's a mess. I go, he has CYP1B1. See, there it is. And he has some GST1, GSTP1, GSTM1, glutathione redox site, okay? So they're hoarding some of these toxins in phase 1 and not getting them to phase 2 for conjugation. So we can open this up. Some things that we use are DIM or DIM combos with NRF2 promoters, and we can start slowly post-dose when phase 2 is opened up a little better to start sending some of those toxins that are accumulating over to phase 2. to get them out of the body. Okay. Feeling my check liver light might come on this weekend. Liver, liver, liver. You have to love your liver, take care of your liver, it'll take care of you. So this is a cell, and we have, real quick, it just shows that it's made of phospholipids, but I want to look right here really quick, and if you can see it, when you see the slides, when they put this online, SOD enzyme pathway, glutathione. So in the cell here, and we're going to look, inside the cell is a mitochondria. Here's a mitochondria. See all these little mitochondria inside the cell? And there's a receptor in the mitochondria that Dr. Shade speaks about very well called NRF2. And in order to, once we get the body-supported phase 1, BH4 across NOS to stop negative impact at GST-SOD, and we're going properly across urea to Krebs, then we can see about, and it depends on the child, because sometimes you have to get this going a little bit first to kind of open up some of that flow, so it's very, it's independent, it depends on each kid. So the emerging role of NRF2 in mitochondria function. So, and I'm going to go because I've got my next slide, I think, has the 200 studies. So crucial role in maintaining cellular redox homeostasis, affects the mitochondria membrane potential and ATP synthesis, mito, influences mitochondria fatty acid oxidation. My kid has problems with mitochondria fatty acid oxidation, my doctor told me on the labs. Yes, NRF2. Structural and functional integrity of the mitochondria. And it's emerging role, these are studies. I'm going to pick this up. Right here, if you want to see the last 200 NRF studies published on PubMed, and I captured that. Clinical trials research too. And NRF2 promoters, here again is sulforaphane, the broccoli sprouts, Japanese knotweed, resveratrol, green tea. So, and each kid, it's going to be a little different on which promoters for him. So we walk through the back-end methylation, and I made it. Okay, you have brains in your head, your feet in your shoes, you can steer yourself in any direction you choose. Our doctors look at our children at a 30,000-foot view. Broken methylation, front-end methionine synthase, and sulfation. And you see them once or twice a year. And they go, okay, your labs are off, here's your scripts for your pathogens, here's a script for leucovorin, here's some methylcobalamin, and I'll see you in 6 months. What do we do the other 365 days a year? And what if it's not working? And I ask this all the time, who's your child's primary care physician? Okay, who's your child's primary care physician? Who's your child's primary care physician? You are. You are your child's primary care physician, right? Okay, I don't know, am I done? Do I have any time for questions? I have time for a question? Yeah. Okay. Can you get BH4? Well, they have paternine 4, and I found it works phenomenally. In these kids, energy test for, in a flare, to calm down, to reset the BH4 cycle as fast as you can for 1 cap twice a day. And as they start improving their own natural production of BH4 across NOS to urea to Krebs, then they start energy testing for a half a cap twice a day, and then a half a cap, and then they can be off of it. And $95 a bottle. It's nice if you can get them weaned off. But it's one of the quickest ways to reset a BH4 cycle. Is you get your nutrients and front-end methylation feeding that BH4 cycle, appropriate for your child, depending on mutations and need in labs. But sometimes you need a quick reset, and that's supplementing BH4 and sometimes top down the tryptophan and the tyrosine, because you need tryptophan and vitamin D and enough BH4 to make serotonin and melatonin for sleep-wake cycles and improve mood, focus, and attention. So I find that that's one of the fastest way to reset the cycle with the other nutrients in there too. Do I have any other questions? Okay, yes?
Well, where do I go to get this information, and who can bring it for me?
Well, Dr. Amy Yasko has a lot of presentations on some of these. She only stuck some of the mutations. I do have a small private support group that I teach all this back-end methylation. I am also a private biomedical certified health coach and Reiki master practitioner. So not only can I help a parent take hold of your child's own genetic mutations, and though it can seem overwhelming, we only look at your child's mutations. So even though there's many out there, I walk you through front-end methylation, and here we go, BH4, NOS, SOD, where are you hung up? I had to do this for my own children. My Joshua, I did not know he was mini pans flaring 3 to 5 times a week. I thought that was his baseline. I didn't know which kid I was going to get up in the morning, if he was going to transition to the bathroom, to